Hello, we're going to do chapter 19, the digestive system. My favorite system because, you get to eat. So we're actually going to be doing PowerPoint slides, but I want to remind you to go ahead and get out your CPTs so that we can kind of look at some of these codes as we go through. I want to remind you that I've actually already gone through and labeled. You guys know how I do this. If I have time at the end of our PowerPoint, I'll go ahead and pull my webcam over and I'll just show you how I have put my labels, so that way you'll just have a frame of reference and just ideas of how you may want to do yours. Okay, so on to our slideshow. So the digestive system. Okay, this is how the digestive system is divided up. It's divided by anatomic site from the mouth to the abdomen, peritoneum and the omentum, plus organs that aid the digestive process. There are many bundled procedures, and surgical procedures are open and endoscopic. So these are all of our little subsections: mouth and related structures, the pharynx, adenoids, tonsils, esophagus, stomach, intestines, appendix, colon, rectum and anus, liver, biliary tract, pancreas. The digestive system subsections includes codes from 40490 through 49999. So on what basis are the digestive system codes divided? They're divided according to anatomical site, beginning with the lips and ending with the abdomen, peritoneum, and the omentum. What are some of the organs that aid the digestive process and are included in this subsection? It's going to be the pancreas, the liver, and the gallbladder. And what else is included in this subsection? Abdomen, peritoneum, omentum, and hernias. So let's talk about our first subsection, the lips. So a vermilionectomy, 40500, is the shaving of the lip. The vermilion border is the area between the lip and the mucosal surface of the mouth. We have large defects, which are in the 40510 through the 40527 section, repaired with procedures such as the transverse wedge excision, which is 40510. Now, I'm just looking at that particular part of my CPT, and that falls under excisions. Okay, now we have the repairs, which start with the siloplasty, which is a lip repair. You have the full thickness repair, which is 40650 through 40654. And then you have cleft lip repair, 40700 through 40761. This is the first subheading of the digestive system section. Name a reason why a vermilionectomy with repair would need to be performed. Well, if you have a patient with cancer of the lip, you would need to do a vermilionectomy. What is a cleft lip? It's a congenital defect when the muscle and the tissue of the lip didn't close properly. Okay, so we're going to move on to tongue and floor of the mouth, 41000 through 41599. So let's look there in our CPT. Okay. Incision and drainage codes are based on sublingual, which is under the tongue, submandibular, which is under the mandible, and the masticator space, which is the floor of the mouth, to the hyoid bone. Extraoral is outside the mouth. The IND of an abscess, cyst, hematoma on the floor of the mouth. Look at code 41015. It says extraoral, incision and drainage of an abscess, cyst, or hematoma of the floor of the mouth. Sublingual. Then 41016 is submental. 17 is submandibular. I'm sorry, submandibular. I said the wrong word. And then 18 is the masticator space. So that's a little bit more, and that's where the extraoral is found. It's from the 41015 to the 41018 in your CPT. Take a look at that. So incision and drainages are based on the location of the abscess, cyst, or hematoma. What other categories fall under the tongue and floor of the mouth subheading? So we have incision, excision, repair, and other procedures. So you can see that's in the blue. Tongue and the floor of the mouth is written in red, right above CPT code 41000. Then in blue, you have incision, excision, repair, and other procedures. So our next portion is the let's sound it out. Dentoalveolar structures and palate in the uvula. (41800) through 41899. It's the bone, the osseous, and the soft structures of the mouth, anchors of the teeth. The palate in the uvula is 42000 through 42299. Palate, roof of the mouth, uvula is the pendulous structure at the back of the throat. Dentoalveolar procedures consist of drainage of an abscess or a cyst and excisions of lesions. Palate and uvula subheading contains codes for incisions, excisions, and repairs. Grafts are reported separately. So let's look at that portion of our CPT. So the dentoalveolar, that's the best I can do with that word, guys. Starts at 41800, which is incision. Then you have excision and destruction. Remember, that's in blue. Other procedures. Then right underneath, palate and uvula, 42000. That's your incision. Then you have excision and destruction, repair, and other procedures. So now we're going to move into the salivary glands and ducts, 42300 through 42699. That's just one page over. You have three salivary glands: the parotid, submandibular, and sublingual. And the codes are divided initially by the gland. So let's take a look at salivary gland and ducts, starting at 42300. So we have the incisions, and I'm just kind of looking through to kind of see the difference in each code. If we look at 42408, excision of the sublingual salivary cyst. So you just have to be careful that you're in the correct salivary gland. Codes are divided based on the gland the procedure is performed on or the number of glands involved. Imaging guidance is reported separately. So next we're going to move to our pharynx, adenoids, and tonsils. Which category are the biopsies found in? Excisions, destruction. Incision category is for peritonsillar abscess. I don't know why I put that question first, but let's go into the esophagus. Hang on, I've got a missing slide. Let's go back to Pharynx, adenoids, and tonsils. I don't know where the slide went. I do apologize. I thought I double checked, but I missed one. Okay, so incision codes are 42700 through 42725. Initially divided on approach, intraoral or external. Again, we're talking about pharynx, adenoids, and tonsils, 42700 through 42999. Tonsillectomy and an adenoidectomy are 42820 through 42836, and they're based on gland removed and the age of the patient. So let's go to 42820. It's a tonsillectomy and adenoidectomy younger than 12. 42821 is age 12 or over. And then the codes continue on. I would suggest that you do some highlighting or note taking in that area. Just make sure that you have highlighted or underlined the age difference in those codes. Now let's go to the esophagus. Sorry about that. We just had to backtrack a little bit. Okay, so the esophagus, 43020 through 43499. The approaches, incision and excision, are cervical, thoracic, abdominal, and endoscopy. So code esophageal dilation. The first thing you need to know the device or the method used. The second is how each device works. And third, whether dilation was endoscopic or non-endoscopic. All that's going to be clear to you when you look at your medical record or your medical scenario. Diagnostic endoscopy always included in the surgical endoscopy because we have to diagnose to do the surgery, right? The key for billing removal of foreign bodies of the esophagus is the approach. What approach does code 43100 use? Well, we have the answer, but let's look at it anyway. 43100, excision of lesion, esophagus with primary repair, the cervical approach. So your approach is going to be listed in the description of your CPT code. Esophagoscopy, 43180 through 43233. So let's make sure that we're there in our CPTs. 43180. And you're going to see that in that category in blue, you have endoscopy. And then you have some notes underneath endoscopy. Remember to read through those and highlight and make notes. So this is limited to the esophagus only. The scope may be advanced into the stomach, but is short of the pylorus. If the scope transverses pyloric channel, it becomes an EGD, which is 43235 through 43259 or 43210. So you can go ahead and flip to those codes. Let's go to 43235. 43235. And you're going to see all of those codes there. I would suggest that you spend some time just looking, highlighting, bubbling. If the scope passes beyond the second portion of the duodenum, report endoscopy, small intestine codes 44360 through 44008 or 44408. Multiple procedures the same day, same provider, you need to add the modifier 51. Biopsy on 2 different sites, add the modifier 59. So do some researching on modifier 51 and 59, making sure that you know when to amend those. So let's move into the stomach. 43500 through 43999. Gastric bypass performed for morbid obesity. There are many types, such as an RNY, and they may be performed via laparoscopic. Bariatric surgery is 43770 through 43775. The gastric restrictive device, such as a band. Some procedures are performed open when the stomach is in full view to the physician, and others are done laparoscopically. Be certain to identify the approach used. The gastric banding is adjustable because the band is a hollow tube that can be inflated and deflated with the administration of fluid. Guys, I had the gastric sleeve done, and when I went for education on that, gastric banding is not used as often anymore as it used to be. Now they almost always do the sleeve or the bypass. Intestines, except for the rectum, 44005 through 44799. Go ahead and make sure you're in the right spot in your CPT. So 4400. Okay, I'm where I need to be. Intestines except rectum. Separate procedures are common. Colostomies are always bundled in with the major procedure unless the code states otherwise. Small intestines extends from 20 feet from the pyloric sphincter to the first part of the large intestine. Large intestines extend from the end of the ileum to the anus. 4 parts: the cecum, the colon, the sigmoid colon, and the rectum. If you don't know the parts of your intestines, your small and the large intestines, please take it upon yourself to do some research and make sure that you know where all of those things are. It's just going to make you more comfortable in your coding. Endoscopy small intestines, 44360 through 44408. So let's move there in our CPT. 44360. I have my spot. I hope you have yours. Diagnostic bundled into surgical endoscopies. Code to the fullest further extent of the procedure. And through stoma, you report 44380 through 44408. Endoscopic codes can be found throughout the digestive system subsection by anatomical site. If diagnostic endoscopy is coded separately, is the diagnostic endoscopy coded separately when the surgical endoscopy is performed? No. Surgical endoscopy always includes the diagnostic endoscopy. Once atomic site has been determined, what other factor guides the code selection? The surgical procedure. Endoscopy terminology. Notes define specific terminology. You're going to be finding notes all through your CPT. You need to read those. Do not disregard them. Code descriptions are specific regarding technique and the depth of the scope. Esophagoscopy is esophagus only. Esophagogastroscopy is the esophagus to pass the diaphragm. I'm not going to attempt the last one. I can do it if I write it on the whiteboard, and I'm not going to do that. Esophagus to beyond the pyloric channel. Read notes preceding 45300 through 45398. 45300. I'm getting there. Are you getting there? It's endoscopy, and it has a whole list of definitions. Make sure that you get in there and read those. The notes define the specific terminology that should be used. In particular, read the notes preceding 45300 through 45398. Those are some really good notes. Make sure you get in there and read those. So that you're going to be seeing sigmoidoscopy, colonoscopy, and different things like that. I want you to get in those notes that are found before 45300. Read, highlight, make notes, whatever you need to do. Understanding the terminology is crucial to coding the procedure appropriately. So these are just some questions. I want you to read through those and make notes of the answers. I'm going to continue on with our slideshow, but these questions that are here, they're only made for you to make notes and make sure that you answer them and that you know those answers. Colon procedures and screening. For colonoscopy procedure, determine how it was performed. Through a colostomy, through a colotomy, through the rectum. For colorectal cancer screening, you're going to see the HCPCS Level 2 codes, which are found in your little HCPCS book. And they range from G0104 through G0122. And this is a colon that has cancer. Laparoscopy and endoscopy. Some subheadings have both laparoscopy from outside and endoscopy from inside procedures. Example, subheading esophagus, endoscopy views inside, laparoscopy is inserted through the umbilicus and views from outside. Laparoscopic bariatric surgery codes 43770 through 43774, the use of the gastric band and our subcutaneous port components. Some headings include both laparoscopy outside and endoscopy inside, so you need to be paying close attention to that. What is a hemorrhoid? It is an inflammation of the area around the anus. Hemorrhoids may occur inside or outside of the body. There are different degrees of severity. Who should determine the degree of the severity? The physician should. So hemorrhoidectomy and fistulaectomy codes are 46200 through 46320. So let's move there in our CPT manual. 46200. I'm where I need to be. Are you? They're divided by the anatomy. Subcutaneous means there's no muscle involved, and submuscular means the sphincter muscle is involved. Complex fistulaectomy involves excision, incision of multiple fistulas. Abdomen, peritoneum, and omentum subheading. So let's go to 4900. I'm there. And it's all the way through 49999. So you're going to see laparoscopy there. Diagnostic is going to be 49320, and the surgical is 49321 through 49323. Repair category contains hernia repair codes. The abdomen, peritoneum, and the omentum subheading includes a repair category that contains hernia repair. So I'm actually going to the repair. And it's going to start at 49491, hernioplasty, herniography, and herniotomy. So that's where you find those codes. So hernia codes are divided on the type. For example, inguinal or femoral, initial or subsequent repair, the age of the patient, clinical presentation, which could be strangulated, blood supply is cut off, or incarcerated, cannot be returned to the cavity, or not reducible. The implantation of mesh or a prosthesis is reported separately. Hernia repairs using an abdominal approach are reported with the use of codes 49491. So I'm looking at repair, code 49491, repair, initial inguinal hernia, preterm infant younger than 37 weeks gestation at birth, performed from birth to up to 50 weeks. So it really does give you lots of definition in those codes. Hernia repairs performed through laparoscopy are reported by means of codes 49650 through 49659. Name of some types of hernias: inguinal, umbilical, incisional, epigastric, and lumbar. Did you ever know there were so many hernias? And that's the end. So let's stop our share. And I am actually going to get my CPT ready to show you guys how I did mine. Give me just a second. All right, so let me move our camera so don't get seasick as I'm moving you. Bear with me. Takes a little doing. Well, I just knocked my little doohickey off. So we're going to have to just make it work. Well, I'm trying to gauge the best way to show you. So it's just like the others. This is my digestive system. And then I did the lips, mouth, tongue. The dental, the salivary, the pharynx, and I did a big tab because it's a lot to write because you have all that here. Have the esophagus, have the stomach. Then I did bariatric surgery, intestines, laparoscopy intestines, colon and the rectum, colonoscopy. And then I have the liver, the biliary tract, the pancreas, the abdomen, the omentum, and the peritoneum here. And then that's how I actually labeled it. Again, I want to remind you that you have your, I call this a glossary. Has some anatomy. So if you wanted to look it up, I mean, you can use it in several different ways. You can look up your codes here or your code sections here, go to the index. If you know where it's at in your tabular, you can go straight there. But you have these tools that you can absolutely use. And you guys see I've started making my little notes and my little highlights and all of that good stuff. All right, well, I hope that you guys enjoyed the digestive system. It's one of my favorites. I think you're going to enjoy coding it. Try to point that at me. You're going to enjoy coding it. I had a lot of fun coding it. And so there we go. That's the digestive system. I did load your objectives and your little key term and how to pick out a key term for the digestive system for you for today. If you have any questions or you need anything, just let me know. Bye, guys.